like to welcome everybody to tonight's special meeting of the Yarra Drug Health Forum. And this has come about because of the fantastic work that has been done by the City of Yarra in guiding our community through the real dilemma around how we manage the public consumption of alcohol within our municipality. And some people from the City of Yarra and a lot of experts have worked really hard to get us to this point. But before I start the introduction, which I've sort of started, my name is Peter Wearne. I chair the Yarra Drug Health Forum, and I'm on Wurundjeri land, people of the Kulin Nation, and we're all meeting on Aboriginal land somewhere, I assume, unless someone's from overseas. And I'd like to acknowledge the traditional owners and the traditional elders of this country that we're meeting on, wherever it might be, and pay our collective respect to the leadership and the eldership of those nations, and recognise that no matter what land we're on, we're meeting on stolen land. And we're in a process of trying to make sense of that and heal that. And it begins with us acknowledging it. And it also begins with us acknowledging that we've got a long way to go, and that racism and bigotry is still alive in our communities. And we want to be allies against that. And we do that by acknowledging and respecting the 60,000-year-old tradition of Aboriginal custodianship of this land, the wisdom, the love, the care, and the spiritual nurture that they provided this land. And we acknowledge too the emerging leadership of the Aboriginal community, and look forward to them growing strong and young and helping to lead this country into a much better future than much of our past has been in terms of relationship with our Aboriginal cousins and brothers and sisters. So that's an important thing to acknowledge, because the forum tonight is tackling another difficult social issue. And we've got some fantastic speakers lined up to do that. But just before we start, I think we need to acknowledge that although this is not an official part of the City of Yarra process in working its way through a really complex and difficult social issue around the management of alcohol in public places, we want to acknowledge that we hope to contribute to that discussion through informed presentation and sometimes maybe passionate viewpoints, but always respectful. And we wish to acknowledge the tremendous leadership that has been provided through the City of Yarra, through their staff and through their consultations with communities around trying to work our way through this conundrum. And we hope to be part of that solution and part of the leadership of that solution. So welcome everybody, and we've got some, like I say, some fantastic speakers tonight. So we have, to lead us off, Miss Sally Mitchell, who is on the executive of the Yarra Drug Health Forum, and she is going to introduce the topic tonight. Over to you, Sal.
Thanks, everybody, for joining us tonight, and thank you, Peter. So Yarra Drug Health Forum has been working collaboratively for the last 25 years on alcohol and drug issues that impact in the City of Yarra. And the focus has always been on how do we find health solutions to those challenges that we have in our community. We always try to encourage a variety of opinions to be aired and try to have really robust discussions, because we feel that that's the best way that we can come up with the best solutions. And tonight's forum reflects how we've always organised our community forums, which is that we look at what are the current issues in the community and how can we add to that discussion. So this forum was chosen today based on the current issues that are going on in the City of Yarra and the discussions that are happening within the council. So in 2009, the City of Yarra introduced Local Law 8 to address the issues in relation to public drinking. And at the time, it created some concerns amongst some members of the community, and particularly some of the agencies providing services in Yarra, about the impact that that might have on vulnerable people. That law will expire at the end of October this year, or in October this year. And since the end of 2019, maybe actually a bit earlier than that, Council has been looking at the issue of public drinking and how it can respond to that in a way that is comfortable for the whole community. So there's been quite a lot of research that's been done, and also lots of consultation across the community. On December the 2nd in 2019, Yarra Drug Health Forum had a community forum which was looking at public drinking and public drunkenness. And some of the research that was presented there was from two researchers at Turning Point, Michael Savage and Amy Penny. And we also had Maya Havrolova from VHHS, who presented talking about public drunkenness and some of the health approaches that the department was looking at that point. So in some ways, this forum tonight bookends the work that the City of Yarra has been doing. So some of the challenges in the City of Yarra, which are around the area of public drinking, relate to the fact that the City of Yarra is an attractive place for people to come when they're looking for entertainment and opportunities for social activities. That means that at various times we have large crowds that are in the area, in various places in the area. And some of that is also influenced by the fact that on our doorstep we have some major places that attract people, in particular the sporting precinct of the MCG and Amy Park and other places around there. So there are issues for the City of Yarra to think about in terms of management of large crowds. Some of that nighttime entertainment and the economy that's around there is really important to the City of Yarra. It's important for some of the way that it develops the culture within our community. And so that the council's really conscious that it needs to support that. In addition, those things have an impact on community safety and public amenity. And those are two things that are very important to local government in terms of their responsibilities for addressing those sorts of issues. And finally, the City of Yarra is very conscious of the needs of vulnerable members of our community, whether they're people who reside here or people who happen to visit here from time to time. So these are really complex and challenging issues, and in some ways they create opportunities, a range of opportunities and a range of solutions, but some of those are in contradiction to each other. So the council has drafted a new local law which relates to the consumption of alcohol in public places. Pardon me. And the new local law aims to balance the different and conflicting needs of the community, the Yarra community. The consultation process is open until the 19th of August, and further information about that can be accessed via the council's website, and Nick will put a link to the Your Say page up in the chat room so people can jump online there if they want to have a look. On Your Say, there's an opportunity for people to ask questions, which will be answered by council staff, and there's also an opportunity to make comment as well. And there's quite a lot of information there about this proposed local law. Now, look, I can see Lucas is online and he might know the answer to this. He might not also, because we don't really know what's going to happen, but there were some pop-ups that were proposed for opportunities for people to see or talk to council staff on the weekend that's coming. I'm imagining that they may be influenced by COVID restrictions, but that's another opportunity for people as well. So we hope that the presentations tonight will and the discussion we'll have afterwards will provide people with food for thought and opportunities to have good discussions and debates with each other in a respectful way tonight. understanding that there may well be different opinions sitting around the table, the virtual table that we have here tonight. So thanks very much for joining us, and we hope you enjoy the presentations and discussion. Thanks, Peter.
Yeah, thanks, Sally. Thanks for that summary of a bit of the context and the history. We have 4 speakers tonight. The first of our 4 speakers is Mr. Rob Moodie, who's the Deputy Director of the Melbourne School of Global Public Health. I think that's right, Rob? Is that right?
Yep.
That's right. Rob is a bit of a public health superstar in this country. He was the first CEO of Vic Health. And not only that, but he was a massive advocate around international refugee health and a practitioner in that space. He has international, national and local experience. And I had the great privilege of serving under Rob on the Premier's Drug Prevention Council for 4 years back in the mid-2000s. And it's with great pleasure that we invite Rob to share his collective knowledge and wisdom gained over many years of thinking around public health. So over to you, Rob.
Thank you, Peter, and thank you very much, Sally. Thanks for the opportunity. And I mean, a couple of points perhaps to make to begin with is these are really difficult issues, and it's interesting reading the research around this and talking to people who've actually done the research. And frankly, in Australia, we have a couple of people, that, particularly Robin Room and Amy as well, have done more on this than most. Probably Canada's the next place where this has been written about the most. So just to say, I mean, we are collectively grappling with a major issue, and I guess one thing I would really encourage us all to do is not only think about a problem, but think about this as a learning opportunity. And I don't say that tritely. I mean, I really do, in terms of whatever is going to happen, in terms of how the City of Yarra determines to manage the issues of public drinking of alcohol, then there's a lot more we can learn about it as we implement whatever programs, and I'll come back to that in a minute. I mean, also just congratulations to the City of Yarra and to the Yarra Drug and Health Forum. I think you guys actually, in terms of the way you actually go about considering your community, then you're right up there in the top league of local government, certainly in Victoria, let alone Australia. Perhaps I could start with just a consideration of what might be the desired outcomes that we're really thinking about. And I was just trying to think about this myself. And, as someone who might be involved in this as a consumer, then I think what we want is in a situation where people can enjoy each other's company, can consume, in this case, alcohol in the safest possible ways that doesn't lead to harm for those who are actually drinking, nor does it lead to those in their particular family or social circles, or those in their physical surrounds. So sort of trying to keep out there what sort of state are we really trying to develop. And it's been interesting, obviously, reading the work of the expert working group on the decriminalisation of public drunkenness in Victoria, and it's now as it has been in many other places, this is seen as a social, an emotional health, a physical health, a mental health issue, not as a criminal issue. And we've learned around this with other drugs. The better these drugs of addiction and drugs of enjoyment and recreation are much better dealt with, and much more effectively and cost effectively dealt with as health issues, primarily with the support of really important law enforcement often, and legal services, because it does produce a lot of conflict, but primarily coming at it from a health perspective. And unfortunately, often we have the drumbeats of popular press turning this just into a law and order issue, which really doesn't take us very far at all. There are many groups that really need to be involved in this, but primarily if we're considering this is about the health and the social well-being of people, then I think we're starting at the right place, and certainly the Victorian government's really underlined that in its approach to decriminalising public drunkenness. The other point I'd just like to make, if I can, is that as a public health practitioner, as a doctor, but really as a public health practitioner, public health is about organised actions of a community or of a society. It's a science, but it's also an art. And this is exactly where I guess the art comes into it. And the art is really to do about relationships. And relationships are absolutely key in this area, because we have many different groups that make up a local government area. Just as Sally was mentioning, we've got residents and visitors who drink in the area. We've got first responders who are involved, be they police or be they paramedics. We've got residents who aren't necessarily drinking in public, but traders that are working in the area. And we may have quite different views about these issues. And one of the key underpinnings of success anywhere globally is the fact that where it works well because people talk to each other, or even more importantly, they listen, and they listen deeply, and they listen and really try to work out where is that common ground in the middle. And if those relationships, and they need to be built up over time, they need to be supported, there needs to be ways of really developing good relationships over time, then get them right, and the possibility of minimising conflict and minimising harm is really possible. We can take really different approaches to this, and we can very easily exclude people. It's done really quickly. You have legislation, you have even urban design, where you design a place, so you take away seats, or you take away where people might gather, you provide pretty high-level surveillance on them, and then you provide a discourse, which is really around prioritising the views and the wishes of certain groups particularly over those that are vulnerable. So that notion of we other people, so we develop an us and a them, and that's a really quick way of excluding people. And again, if I look at public health approaches across the globe, then when that happens, you get into real strife. On the other hand, when you have higher levels of really empathy between different groups, you have higher levels of compassion, you allow people to talk to each other, you encourage them to get to know each other, then there's a fair chance that will work better. And I think local governments are really crucial in this area, and I'm a huge fan of local governments. I forgot to say that I actually really like paying my rates. I've actually got a photo of myself with a big smile with our rate notice. Why? Because I've actually lived in enough places where you don't pay rates and you don't get anything for it. So, the role of local council, local government, I think is incredibly crucial in virtually every aspect of life, but particularly in amenity and our own physical and in a sense social surrounds. So, I think it's how can local governments consider solutions that really support this acknowledgement of multiple groups, of the one that can celebrate difference rather than hound it out, and can encourage public space that's used and shared by different people for different reasons, and acknowledge that. And how do we understand that and express that? And again, this is the art, not so much the science. I mean, obviously, and Sally was really talking about it, two major aspects of this really is one is about managing large crowds. Obviously, New Year's Eve, Grand Final, you've got, and I think this is where the council's already started to look at pretty imaginative solutions, and in a sense, because of its relatively short-term presence, then it's more manageable. The other issue, which is really around managing consumption of alcohol, particularly in public places where it's involving particularly vulnerable groups, then that's different. It's longer term. I mean, it's something that is difficult across the globe. But again, it was interesting coming back to the expert working group and their focus on and which the government has actually seemed to be supporting, is the notion about, again, integrating different aspects of an approach. And that includes around a really high level of work with potential first responders, be they police or ambulance, but also in a sense of working with medical practitioners as well, to ensure in a sense that whatever we are doing, then we're really maximising the chances of those at risk to, in a sense, to be dealt with safely, because we certainly know some of the issues around where we've got probably junior police who are dealing with particularly Indigenous Australians, and they may not have a great knowledge of what's going on. They may have no idea about trauma-informed care. They may be much more concerned about, my goodness, I better do the right thing by my boss than what I think that is the right thing, than actually listening and talking and managing this in a way where they feel comfortable and obviously where the community they're dealing with feel comfortable as well. So, and there's an interesting move afoot, I guess, and one of my colleagues, Nick Cross, has been pushing this, is the notion of public health and law enforcement working much more closely together, so that we actually understand each other's views and that we can support each other. If we work separately, it just doesn't work. There's so many areas where law enforcement and public health cross over. And we're just seeing it more recently, actually, with COVID, and where we've had a public health response to COVID and we'll let police out. And they come in and then have a different approach, and that doesn't work. So, it's a question of us supporting each other, and aligning our responses and learning from each other, which is essential in whether we want to manage drug use, alcohol use, whether we want to manage infectious diseases, whether we want to manage road trauma. Then there's so many areas where the health sector can really learn from police and vice versa. And the other areas where the expert working group was focused on, is in a sense safe transport. So in a sense, if people have to be moved, or they're unsafe, or they're actually, they've lost control, they've lost function, then they need to be transported safely to somewhere of safety. And it's interesting, and I hope that if you want to be in it, then the City of Yarra would be involved in one of the pilot projects of the state government, because that would produce a lot of really great learnings. There are other options where we're looking at possibility of using other health institutions where we can modify those for use as sobering up centres. I spent many years working for an Aboriginal community-controlled health organisation in Alice Springs, and where the first sobering up shelters were created, and they did really make a difference. As a doctor, they made a hell of a difference to be able to, in a sense, make sure that people could literally sober up, rather than either putting them into hospital or putting them into jail. Because we knew if we put them into jail, things would get worse and worse and worse. And obviously, some of the other areas we know works is about bringing people into contact with health and social welfare, their broader lives, so that, particularly around housing, around unstable dwelling is a huge issue for many people. So, and again, I know these are really difficult issues for many people, sometimes intractable, but the point is, how best do we develop our programs and learn from what we're doing? So to finish off, I think the approaches that can be used have to be underpinned by two major planks, if you like. One is the issue I came back to before about effective relationships, really learning from each other. This is about deep listening. And again, local government has such a great role to play in putting different people together and helping them really listen to each other and really question each other respectfully as well. And interestingly, of late, I've been doing some work with a colleague from Harvard who worked on the Harvard negotiation project, and he has this wonderful thing called the influence equation, which is influence is persuasion over resistance. And so often we're trying to persuade people more and more to our view, and all we do is increase the resistance because we actually never learn about what people's real interests are, what really their needs are, and what their concerns are. We are so keen on our own view that, and I can be accused of this, Peter can tell you, myself, and I'm only starting to learn about these different approaches where we can really start to move beyond obvious conflict. And the last point is that whatever is done, and maybe it's over a 2-year framework or longer, is that you plan the evaluation of it now. Don't wait till the end and then think back, how did what actually worked? Because it's such a brilliant opportunity to learn. And if you have an objective view of this, then and not only good evaluation really helps good program design. And I learned this working for the Global Vaccine Initiative, is that we were putting literally millions of dollars into programs and then trying to evaluate them after the fact. And because that wasn't done at the beginning, because if you design a program with evaluation in mind, it will really help you design a much, much better program, because you know what data you're looking for, but you know that you actually structure it and design it in a way that can work. So I really encourage whatever you do that, because again, do this right, and the City of Yarra will be out in front of everybody else in Victoria, let alone Australia. So again, turning a problem into a learning opportunities is a real possibility. So I might end there, Peter, and thank you.
Thank you, Rob. And just to remind everybody, we're taking a bit of a panel discussion at the end when we'll have all the presenters available for questions via the chat room. But thanks again, Rob. And just look at the chat room, because Nick's regularly sending messages through to everybody via the chat room. Look, it's with great pleasure I invite the CEO of Victorian Aboriginal Legal Service, and I'm going to mispronounce your name, George, but it's George Selvanera. Is that right? Selvanera. I'm sorry, George.
I'm just George. My name is George Selvanera. Thank you very much.
Yeah. So we'll hand over to you, George.
Yeah, thank you very much. And it's a pleasure to have just followed Rob, who I think gave a fascinating kind of overview of some of the key issues. So I found listening to you, Rob, hugely informative. So I'd like to also just start by acknowledging and paying respect to the Wurundjeri people as the traditional custodians of the land on which I'm joining this webinar. I'd also like to pay my respects to their elders, past, present and emerging. And I guess wherever you are listening to this in Australia, is that you're an unceded land. Sovereignty has not been ceded. It's always been Aboriginal land. I should start by saying I'm the acting CEO, and I'm not myself an Aboriginal or Torres Strait Islander person, but am acting over the course of the next 6 months whilst Narita Waite, our substantive CEO, is on parental leave. So I can never speak, obviously, with the authority of the Aboriginal or Torres Strait Islander person. But look, I've been asked to say a few words about the draft local law prohibiting public drinking, as well as the ongoing government processes to decriminalise public drunkenness. And from our experience providing legal services, which includes managing a custody notification system whereby VALS is notified whenever an Aboriginal person is taken into police custody, we're acutely aware that Aboriginal people are disproportionately impacted by these types of laws. So by maintaining a local law that prohibits public drinking in some cases, it's clear that the law will continue to be used as a mechanism that disproportionately affects Aboriginal people. The presence, and I think, Rob to some extent kind of made this point, is that police presence can escalate a situation quickly, leading to criminal charges being laid. So if we're serious about a health-based response to public drinking, we have to acknowledge that Victorian police are not the best placed to provide a health response. We note that the draft law does include some safeguards, including that the law isn't to be used in situations where a person appears to be physically, psychologically, socially, culturally or economically vulnerable. And the Procedure and Protocols Manual provides further guidance by requiring anyone enforcing the law to first consider circumstances or offer appropriate support instead of punishment. And look, while, again, we recognise that these are positive improvements, our concern is that this in and of itself will not be enough to support the systemic and cultural change within the institutions that are responsible for enforcing this law. And that is based on our experience. So if we look at the decriminalisation of public drunkenness in all other states and territories around Australia, in all cases, police maintain the power to take someone into protective custody if they're drunk in public. While the legal test for exercising those powers can vary and differ between states and territories, in all cases, information that we obtain through freedom of information laws shows that Aboriginal people continue to be the most disproportionately affected by these laws and continue to be taken into police custody. So at the end of the day, if it isn't a crime to be drunk in public in those states and territories, and yet Aboriginal people continue to be put into police cells, which is not safe and is far from an appropriate and requisite health-based response. So as obviously everyone knows, the Victorian government's committed to repealing public drunkenness and replacing this with a health-based response. Decriminalisation of public drunkenness was recommended by the Royal Commission into Aboriginal Deaths in Custody over 30 years ago now, yet no action was taken in Victoria until 2019, following the tragic death of a Yorta Yorta woman, Tanya Day, who died in police custody in December 2017 on a charge of being drunk in public. Tanya Day's children have been fierce advocates for law reform, and then in August 2019, the Victorian government finally committed to doing what we would say should have been done 30 years ago when the Royal Commission made its recommendations. To support this law reform process, and Rob kind of made reference to this, the government established an expert reference group on public drunkenness in August 2019, and the VALS CEO, Nerita Waite, was appointed as one of the 4 experts. The expert group consulted widely and reported back to government in August of last year. That report, however, was made public in November of 2020 with 86 recommendations. But, I should also say that VALS does not necessarily support all of those recommendations. The government hasn't formally responded to the recommendations in the report. However, they have established a number of working groups that are currently progressing the work, and VALS continues to be involved in this process. The government will shortly announce 3 sites where they'll pilot the new health-based response to public drunkenness, and the results from these pilot sites will then inform, the implementation of a model statewide. So the ongoing work that's facilitated by the Departments of Justice and Community Safety and Health and Human Services is confidential, so it's not possible to share more of those details. But I did want to mention a few of the key findings and recommendations from the expert group. Firstly, that the Victorian government should ensure that no person is detained in a police cell solely for being intoxicated in public. Unlike other jurisdictions, the expert group opposes the introduction of the protective custody power, whereby police can detain an intoxicated person in a police cell for their own safety. As mentioned previously, the power has continued to be used to detain Aboriginal people at a disproportionate rate in all other states and territories. Our view is that police cells are not safe places for Aboriginal people, and in no circumstances should someone be detained in a police cell simply because they were intoxicated in public. That said, the expert group recommends that police should continue to play a role in the model of care currently being developed to respond to people that are intoxicated in public. So Victorian police officers, obviously, as first responders, might well have, powers to respond, but these should be strictly limited and be used as a power of last resort. So, for instance, this could include the power to detain someone for the purposes of transporting them to a safe place, like a centre or a place where a person could sober up and receive other types of appropriate support. So, I mean, I could go on and on, as people can probably tell from this. But, I think in summary, for us, we fully support the decriminalisation. We think that the work that Yarra Council is undertaking is great, and we really welcome that. And what we would kind of, I guess, our challenge to any of the pilot sites is to look for ways to ensure that it is a health-based response. So the whole point of decriminalising public drunkenness is to reduce the risks of people coming into police cells and having that kind of law and order type response. So that's what we would say is actually let's ensure that the role of the police is defined to what the police can do within the context of something which has been decriminalised. Thank you.
Thanks, George. George, and don't tell Narita that I promoted you to CEO in her maternity leave. Anyway, because I'm a bit terrified of Narita. Now, listen, I think it'd be good to actually probably jump to Acting Area Commander Jim Lappin. Jim, can you join us now?
Yeah, that's me. That's
beautiful.
Me,
yeah, beautiful, right. Jim. So
just for the purpose, I'll just get rid of my other phone.
Cool.
So I've chucked this onto my wife's phone.
Beautiful. We can see you.
Yep, cool. Let's get rid of the echo. Bang, sorted. Yeah, so Victoria Police doesn't really allow us to do Zoom, so we need to find other mechanisms.
Cool.
So sorry about that.
No, that's okay, Jim. Yep. No, we can see you now.
Yep.
So Jim's representing VicPol. So Jim is also the acting local area commander that includes the City of Yarra, and police have been a long-term partner in the management of complex and difficult social issues within Yarra over many, many years, and so we welcome Jim's input tonight. Over to you, Jim.
Yeah, thanks. Look, I'm not going to talk too much about our expectations in relation to this because, as everyone would appreciate, that we respond to laws as they are created, whether they be local or But I just one thing I'll say is that I identify as Aboriginal. I'm not a traditional owner on the lands that we speak, although I'm up in Yarra country. But I'm a Barkindji man, which is north of New South Wales. And the thing, just going back to the last presenter in relation to the health perspective of drinking and so forth and public drunkenness, I think we personally and anecdotally, we've quite naturally drifted towards public drunkenness to be a health issue already. Because no one gets charged with being drunk anymore necessarily. It's generally an opportunity for us to protect someone from themselves. In relation to the laws themselves, they're opportunities for us and we don't use them lightly in relation to how we manage public order first and foremost. So if we arrest someone just for being drunk under the current drug laws under Section 13 of the Summary Offences Act, it is for the most part, anecdotally from my experience as a very senior police person now, only because we haven't been able to find any other way of dealing with that person who can't deal with themselves right now. There's no friends to take them somewhere. There's no a way to put them in a taxi because they're too incapacitated. And then we take on a welfare concern of theirs. And that's a lot of risk that we absorb because we need to make sure that they are, if they're in our custody, that we're looking after them in such a way that there's no harm to them after that. The main reason why we would normally take someone into custody because they're drunk is because there's other serious offending attached to that, if that makes sense. In the context of the intent of this meeting, and I don't want to take up too much more time because I think we're like 45 minutes into the hour a meeting, is that where we are flexible and agile to whatever the council want to deem to be the local laws. And, you know, the biggest part of our business is about discretion. And make no mistake, it is, and we would have sent it all to the CHO, the Chief Health Officer's directions and so forth, went heavy light early in relation to enforcement of the CHO directions. But the biggest grey area that our members have is discretion in relation to how we do things, how we enforce laws relative to, there's the law, then there's community expectation. And we don't take that flippantly. Whatever it might look like by exception with different things that are going on, it is really important to us that we balance what we're allowed to do with what we need to do. And it's really, really important to us. And so in relation to the intent of the bylaws of Yarra, there's still that discretionary. So I don't want to say much more than that. What I'm really more curious about is being available for question and answers, because I don't want to talk at the audience that have signed in. I more want to address, because we don't know what are the issues they want to. So I'm not going to go on my high horse and talk about stuff that potentially is not hitting the concerns of the people that have taken the time to subscribe today. So I pretty much just wanted to set that scene and then let the meeting move on. And I feel as though I'd be more valuable in Q&A.
No, I really appreciate that, Jim, and I'm sure there'll be many questions that will involve your expertise and your knowledge of local policing. So thanks, Jim. Really appreciate your input. I'd like now to go to Megan Pearce. Megan Pearce has been a long-term lawyer working for the Fitzroy Legal Service. And I'm going to get Megan's title wrong, but when I might write down my notes, it's Megan's involved in the area of public advocacy and around vulnerable communities within Yarra and this area. And Megan and the Fitzroy Legal Service authored a letter to council around Local Law 8, and we invited Megan to speak to what concerns or what viewpoint the Fitzroy Legal Service has. So over to you, Megan.
Thanks very much, Peter. And you've summed up the functions of my role much better than my job title does. So thank you very much for that. I want to begin by acknowledging that I'm coming to you from stolen Wurundjeri land. And in light of the conversation tonight, I want to particularly acknowledge the leadership of Aboriginal people in creating community-driven solutions to the complex and wicked problems that we're all talking about tonight. I'm really pleased to be invited tonight and really pleased that the discussion has been led by a public health expert, and I'm particularly grateful to Yarra Drug Health Forum for bringing us all together, and also really grateful to Jim for coming along today and sharing his views, and I'm really keen to hear from him in the Q&A as well. And it was also great to hear from George, particularly on the risks of any enforcement approaches being applied in a way that can disproportionately affect Aboriginal people. And I guess at the outset, I'd like to just highlight that we are having this conversation against the backdrop of skyrocketing rates of Aboriginal people in custody, particularly Aboriginal women. One statistic that I find really arresting is that Aboriginal in the 2019-20 financial year, between 2009 and 2010, and the most recent financial year of 2019-2020, the number of Aboriginal women entering prison on remand increased by 440%. And we've consistently heard in consultations about various iterations of the law that we're talking about tonight that Aboriginal people feel targeted and discriminated against by laws prohibiting public drinking. And I guess what these statistics show to us and what what the information that George shared with us earlier shows to us is that perception is absolutely borne out by the staggering overrepresentation of Aboriginal people in prison. And I'll turn to some more specific comments on the law that we're considering tonight, but I guess I thought I would start by just outlining Fitzroy Legal Services' general position, which is we were opposed to the introduction of more comprehensive, if you like, ban on public drinking that came into effect in 2009, and that was extended in 2019, and it's an alternative version of this law that we're talking about tonight. In opposing the law, I really, in our opposition to the original law and to the reservations we have about some aspects of the current law, I don't want to minimise the really genuine harms that can flow from the misuse of alcohol. But I guess ultimately Fitzroy Legal Services' view is that we don't consider an enforcement approach is tailored to addressing those harms. And I guess I'd like to pick up on Rob's comments about the complexity of the issue and the importance of relationships, which I'll do so shortly. I do also, though, want to really commend Yarra City Council for crafting a version of this law that really aims to squarely tackle the harms that we're talking about, particularly the harms associated with the policing and enforcement of public drinking. And the version that we're considering tonight goes a really long way towards doing that. And part of the reason it does that is because it limits to a fairly significant degree the circumstances in which public drinking can be policed. So I wanted to pick up on Rob's idea of this being a really complex problem, and that's been abundantly clear in our participation in the consultations relating to this law to date. And I guess ultimately we just think that enforcement is a really blunt tool to address such a complicated problem. What we do know can flow from enforcement in our legal practice is that fines and criminalisation are rarely, if ever, effective in changing behaviour. Fines can be really, really stressful for the people who receive them, and they can quickly lead to people being mired in the quicksand of the criminal legal system. And the overwhelming experience of many of our clients is that interactions with police are not benign and they can escalate. And we see examples of this with family members having contact with police in the context of a mental health crisis, and that person the person in crisis ending up in custody. And we also see examples of it in our practice with police being called out to family violence incidents, and the person who's been the subject of the coercion and control can end up in custody. And so it's just with a measure of caution, a significant measure of caution, that we would support any enforcement of policing public drinking. Turning to the point about relationships being key in this area, we couldn't agree more. And a member of my team is responsible for our community development and is not a lawyer, gratefully. And one of the things that she talks a lot about is investing in relationships in the community. And we think that that's really important for a genuine harm reduction approach, because people do need to have recourse to some sort of avenue if they're concerned about behaviour that they're seeing. But what we think is that as a legal service, we don't think that police are always the right people to be providing that help. And Jim talked about balancing what police need to do with what they can do, and also often feeling like police are a real last resort. So I guess what we would love to see is some real imagination about what can be possible in building relationships and in responding to the complex issues we're talking about tonight. At the moment, as a society, police are the only people we can call when there is an imminent threat of violence, but we are also, by default, calling police in a huge number of other situations. And I think we need to ask ourselves whether that's the best way forward. A particular example that I wanted to flag for everyone is the emergence of what I understand is called the Smith Street Working Group, which started because traders and people drinking on the street, when traders in the Smith Street area and people drinking on the street weren't getting along. And then what followed from that was like a really deep and collaborative process of getting together, listening, responding, getting to know each other. And so I guess I would ask Yarra Council to consider what will happen if we really invest in people to getting to know each other. And we've heard a few examples of it about why a prohibition on public drinking is needed in certain situations. But in a lot of those situations, it often begs the question about what if the people involved in that situation really knew each other? What if the people who run childcare centres or who run bars feel like they can truly interact with each other? We all want to avoid situations that escalate, but we need to ask ourselves how we can create a cohesive community in Yarra. And I think one where the histories of exclusion don't dominate. I think one of the things that's also been really difficult in these discussions is that, many traders have expressed a particular preference for having access to this law to control conduct in the vicinity of their businesses. And Aboriginal people have said that they feel they consistently and overwhelmingly feel targeted and discriminated against by this law or by a version of this law. And so I guess by proceeding with an ongoing prohibition of public drinking, it shows that we are preferring the views or experiences of traders over those of the Aboriginal community. And I just think that's, in light of Aboriginal deaths in custody, which have continued this year, and the comments that George has made tonight, I think that's something we really need to pause before we do. Excuse me, I am going on a little bit too long. I will just make a couple more points before I wrap up. I guess we've heard a lot about the value of prohibitions of prohibiting public drinking as a means to ensure community safety. It's something that's come up really consistently in the consultations that Fitzroy Legal Service has been part of, and I would just like to make a comment that the overwhelming majority of alcohol consumption that happens in Yarra happens in licensed premises or on homes. But the fact that it happens in those contexts means that people are not subject to scrutiny by police or other members of the public, and they're not subject to the kind of prohibition that we're discussing today. But the other thing we know is that the vast majority of alcohol-related harm stems from alcohol consumed in private venues. And I think invoking community safety as a basis for laws prohibiting public drinking assumes a link between drinking that occurs specifically in public as opposed to private domains and the kind of alcohol-related harm that we're addressing. And I think that we should just really pause before we proceed on the basis of that assumption. The other thing I would like to do is just quickly talk about the meaning of the term amenity. At the risk of sounding like a grade 9 debater, I looked it up, and it means literally desirability, pleasantness, or attractiveness. And I think when we are talking about such a contested issue as bans on drinking in public, given the historical and ongoing impact that has had on Aboriginal people, we can't ignore that we're asking ourselves, like, who is undesirable and unattractive and to whom? And these conversations are profoundly infused with historical and current power relationships. The one last thing I wanted to say was there are some mechanisms available to police to manage the kind of behaviour that would be of concern. And I think that what we need to do today is have a bit of an imagination and commit to really investing in the kinds of solutions that minimise the need for police involvement, expand the community's toolkit for responding to the harms of public drinking, and respect the really clear position of Aboriginal people in Yarra that they don't want a law prohibiting public drinking.
Thanks, Megan. Thanks very much for your thoughtful presentation. And I just realised that no one under your textbook definition of amenity could ever accuse me and amenity of being two and the same things. I think I fail on all parts. But anyway, look, I'm going to encourage now comment or questions for all of our panellists. And there's been a bit of a common theme through all the presentations. One, that we're agreeing that this is a complex issue, and there is no simple solution. And the question that I have for all of you, and I'll start this off, is given that the intent of what we're trying to do here is not to target a population, and I think there is no doubt that council officers and council staff have really gone out of their way to show that respect to the historic nature of these types of relationships and maybe the unintended harm that these local laws may cause, and that's not the intent. What about the curly question about we've got big areas of public gathering, grand final, every time Collingwood plays at the MCG against anybody, there's thousands of people that come into Swan Street and concerns by the community. How do we manage consumption of alcohol, given that people often arrive intoxicated into those areas and want to continue their intoxication? How do we manage those difficult conundrums? And before I throw to anyone, I'll throw to Jim first to see how useful is that local law, Jim, in managing large crowds from a policing perspective?
It's only one tool. So from managing a loud crowds perspective, alcohol for us predominantly, it's not a tool that we would use to manage large crowds for. Yep. I mean, it is it doesn't even come into the picture in relation to drunkenness. So in relation to large crowds, public order and so forth, we're talking breach of the peace. And in breach of the peace, unless there's this specific crimes being committed, is actually a common law power. So there's no laws in relation to, and we're talking about mass gatherings and crowds and so forth, that we would necessarily lean on Section 13 of the Summary Offences Act, or in that case, the local laws locally. So it doesn't change our business much at all because the dynamics are massively different.
Okay. Any other panellists want to have a dash at that? What about you, Rob? Have you seen? You see the dilemma: large crowds, people coming in wanting to drink in the street. Blah, blah, blah. That type of, I don't mean that disrespectfully, but it's a difficult conundrum for communities to manage, and Yarra's uniquely placed. What's your perspective on how we deal with that management issue?
Well, again, it's I mean, dealing with those that deal with it from each time it arises. But I mean, obviously, for example, Swan Street, having a discussion with the hoteliers, the licensees in the street is obviously something that's really worth doing. And it's a bit like how we used to manage, the Falls Festival, okay, and schoolies. So you really get people together who were either managing resorts or managing events and make sure they're talking to each other, because actually most of them are interested in the same outcome. They want to make a profit, but they actually don't want things wrecked, and they want people to enjoy themselves. And generally speaking, you get them together and you really work on, okay, how are we going to manage with my own staff drinking, people who are obviously drunk coming to responsible serving alcohol, so or whatever. But I mean, it's actually making sure that there's an agreed pattern in how we're going to manage this, for example, along Swan Street, and that will obviously result in the police talking to venue owners, talking to event managers as well. So yeah, I mean, generally, if people sort of know about this, plan for it beforehand, then you can get pretty good outcomes.
Megan or George, do you want to have a dash?
I can jump in. I can't see George and whether he's itching to speak, but I have also noticed a comment in the chat box from Lainey.
Yep.
And I rushed through the point I was making before because I was conscious of the time, and so I'm glad that I can cover off on it in the questions. And very much building on what Jim said. So I want to say at the outset, it's sort of an invidious position to be saying we want less policing generally, and I think that we don't want to be encouraging the use of police powers unnecessarily. But what we are saying, what we do think is that if conduct, as Jim said, rises to the level that it is a concern for public safety or the safety of people around a person or themselves, there exists provisions in the Summary Offences Act that allow police to move people on. And it specifically says police can direct someone to move on if they are or are likely to breach the peace, endanger the safety of another person, damage property, or otherwise be a risk to public safety. And I guess it's just really, it's hard for me to envisage an individual's conduct that would be problematic enough to require the intervention allowed by this local law, but not rise to the level where it could be the subject of a move-on direction. And I would also say that a move-on direction does allow police just to ask a person to move on. And so it could be the circuit breaker that that's necessary. It doesn't require police to arrest them. And if a person doesn't comply with a move-on direction, they can be fined. So that's what I was referring to about the other mechanisms available to police. And it sounds like Jim had something similar in mind in terms of, crowd control. The one other thing I would say is I'd be really interested to hear from large-scale event managers. And Rob, I'm glad that you brought up I think it was the Falls Festival. Because, I've been thinking about, situations where I've been part of a really large crowd, but without a kind of enforcement approach to management. And I'm sure that there are situations where that can be effective.
George, thanks, Megan. George, is there anything that you want to... I think we've got Lucas Gosling from the City of Yarra, who's the, I'm going to get Lucas's title wrong. I'm going to say Director of Community Services or something. But Lucas...
Close enough, Peter.
Yeah, so welcome, Lucas. Yeah, have a go, Lucas.
Yeah, thanks. And look, thanks to all the speakers. We've heard some really interesting information tonight, and certainly there's a lot that, from an officer perspective, that we would agree with. Look, I don't think it's appropriate for me to kind of advocate for a particular position, given that we've got a proposal that's out there for councillor consideration. I'd also just like to acknowledge the 4 councillors that are also in the virtual room tonight. Councillor Amanda Stone, Councillor Sophie Wade, Councillor Ed Crossland, Councillor Herschel Landers. So I have to be very careful what I say, but certainly the one thing that I would say is that firstly, council is large event managers. This is what we do, and in fact, this is one of the primary reasons. And I think with respect to the particularly something like Swan Street and those those mass public gatherings. When the local law is enacted, and is enacted a lot on those events, it is often simply a question of police saying to someone, "Hey, can you just tip that out?" That is enacting the local law. One of the other things that we also have to do is have a conversation with our community prior to these events, and it goes to Rob's earlier point about having conversations with traders, with licensed venues, with packaged liquor outlets and the like. Let me give you the assurance of everyone in the room that council does that work. We do that many weeks and months in advance. And of course, the other thing that I would just say is that the other question about licensed traders dealing with public drinking, of course, they can only do that within the purview of their own venue. Now, of course, if we don't actually have a local law that pertains to an area around that venue or quite close to the venue, then those traders have absolutely no power whatsoever to deal with it. The other thing that I'd also just say is that remember that it is also intended to be a preventative measure. And as I said, there's much of what I would absolutely agree with tonight. And the other thing that I would just say that particularly with respect to some of the mass gatherings and the like, I also think it's important, well, actually two things. One is that we decouple, and I get that we can't do this completely, but we decouple the idea of public drunkenness from public drinking. One is a criminal matter under a certain jurisdiction. Council has no authority to deal with that at all. We do have an advocacy position on it, of course. So that's one question. And the other thing is that the local law with respect to health-based measures, it is not, in my opinion, an either or. And in fact, if you actually read the proposal, it is an and. And so certainly from our perspective, we absolutely agree that health-based responses for the vast majority of the community are incredibly important, and we are committed to making sure that happens. So some of those suggestions, for example, that Megan put forward, and thank you for that, we're absolutely committed to doing those. There's no question. But again, I would echo Jim's comments, which is to say that it is a tool in a kit bag of things to help us manage the public realm, not the only one. So I'll just make that comment.
Thanks, Lucas, and thank you for your contribution. Any comments from any of the panellists? Anything that anyone would like to throw in?
No, I just wanted to thank Lucas for that contribution. It was helpful to understand, and particularly, grounding council's experience in their experience managing large events. I appreciated that. Okay.
Now, I can't see any other questions currently in the chat room, and I could turn this into a question and answer between the panellists and Peter Wearne, but I don't think that would be of interest to anybody. So are there any other comments or any questions that people have? Here we go. To where I've worked at schoolies for the past 5 to 6 years and seen a very different approaches in managing schoolies crowd from different councils. Nick, do you want to elaborate on that?
Well, yeah, I mean, we've just started discussion on what's going to happen this year because last year for schoolies, there was an expectation that a bunch of 18-year-olds that had been locked in, or so 17 and 18-year-olds that had been locked in their houses for the year were not going to go out and party. So there was no provisions made for the record crowds that ended up turning up at places like Rye Rye, Torquay and Cows. And over the years, I don't know, for anybody that kind of pays close attention to the news around schoolies time, which is mid-November, end of November. But I think it was 3 years ago, the riot police were required in Rye, including mounted units, helicopter, and this was all to manage, 17 to 18-year-olds who are getting drunk. And this is because a lot of the approach that I've seen taken by councils is a approach where they just do not want drunk 17 to 18-year-olds there. So their entire approach relies on policing. Their entire approach relies on moving on. And they're essentially, it's a bunch of kids who do not want to be moved on, who want to party. And they, you end up getting some pretty crazy scenarios. So I think it's a good demonstration. So this year, I think they're going for putting on an actual event and trying to control the crowds by having events, by having all the services, a wide range of services, obviously still police, but also private security, the health services, and other sort of council response, things like food vans, entertainment, etc., to keep that crowd in one place and to give them something to do. Which will hopefully be a better result than ending up with the mounted units and air units wasting their time on drunk 17 and 18-year-olds with flares.
Okay,
so
okay.
I thought it was just a good example of how things are done really bad.
So we've got a question. Thanks, Nick. We've got a question from Amanda Stone to all the panellists about any comments about having a different, really about what Lucas talked about. What does the panel think about Lucas's comment about this having a deterrent effect on specific times and places? So the local law 8 in its new proposed form impacting on as a deterrent on different times and places around specific events. Any commentary? Megan, George or Rob or Jim?
Sorry, yeah, where you go?
Yep, you, mate. You, George.
Yeah. I think we have to kind of keep at the front of our mind what the purpose is, and understand, I guess, that if the purpose here is around wanting to have a public health response and to sort of deal with issues of public drunkenness in the context of a public health response, that kind of at moments where we start creating exceptions where we want to use sort of policing kind of approaches, we kind of start to undermine, I guess, that type of response. And I guess, looking at it particularly through the lens of the work that we do at the Victorian Aboriginal Legal Service, we know that there are disproportionate impacts on particular communities, and certainly it's the case that for Aboriginal and Torres Strait Islander communities that they are disproportionately affected by these types of laws. And even if, they kind of are written with the best of intentions, and they're written from the perspective of wanting to be supportive, the actual impact is that this is a community of people that are disproportionately affected, and not in a positive sense, in a negative sense. So whilst there, is already, I guess, Megan, I think, made the point very, very clearly, as did one of the other speakers, is that there's already laws that are kind of in place under the Summary Offences Act in terms of moving people along. But I think to sort of try and carve out exceptions, just to, appreciate that will have consequences, and there will be these, if the intent is to be positive, there will be unintended consequences, and communities like Aboriginal and Torres Strait Islanders are almost certainly to be a group that will be disproportionately affected.
Thanks, George. Jim, you wanted to jump in?
Yeah, I sort of balancing between having my police hat on and having my traditional owner's hat on, and the diversity of the conversation in relation to schoolies in Rye and the violence that occurs down there, because we've got young fellas, young people down there drinking to excess and being quite nasty. And you're right, and it takes a significant policing response. Now, if we think about the context of this actual meeting, you're right, good observation in relation to the challenge of policing for schoolies in Rye, but relevant to the conversation right now, I'm not so sure. And also the other thing, if I put my traditional owner's hat on, is my people are just looking untidy. They're down there, they're having a drink. For whatever reason they've gone in their life, they're stolen, they're off country, And there are a lot of off-country Aboriginal people in Yarra.
Yep.
So most of the Aboriginal people that we're talking to are not Wurundjeri.
That's right.
And most likely they're from interstate. And being off-country is a big, big deal. And if they're sitting down there drowning their sorrows and having a beer, that's all we're doing. We're going down there, these people, they look untidy. And they're the calls we're getting. They're not necessarily offending necessarily. They might get a little bit, and look, anecdotally, okay, because I've been a policeman for a long time. But that's what we're dealing with here mostly, is that we're dealing with an Aboriginal that's been drinking probably all day, and now they're untidy and they don't look amenable. That's something that we would not like to have hanging around because it's potentially not looking good for the environment. It might drift into a little bit of swearing, maybe so forth, but Aboriginal people in public drunk are not necessarily committing serious offenders. Most personally, now I'm drifting to my traditional owners, is that a lot of the harm that's happening with Aboriginal people is behind closed doors, family violence. And that's the bit that we collectively as an organisation or as a society, too hard for us to address. Easy to pick on the Aboriginal person having a few beers and going a bit too far in the street. He's just looking untidy. So that's me personal and a little bit traditional. But we can't draw, for the context of this conversation, the difference between schoolies and Rye and the Aboriginal person displaced from community dealing with a life lived.
Yep.
And they are not getting remanded in custody because they had a beer on the street. So it's really, really hard. I'm really passionate. I got promoted on Monday. I am now the most senior Victoria Police member, Aboriginal in Victoria Police. And I'm actually getting quite, not now, but I'm like, do you know what? What do I do with that responsibility now? The most senior sworn Victoria Police member, Aboriginal in Victoria Police. What do I do with that responsibility? And as I'm sitting here listening to where this was supposed to go and where it did go, I'm probably getting a bit of an idea of what I need to do as the most senior Aboriginal police person going forward, because there's not many behind me.
Yeah.
So I'll just park that for what it's worth in relation to our context. Let's stay focused to what the issue is and not get too distracted, because when we get distracted, nothing happens.
Yeah.
This is about the local law for Yarra.
Yep.
And there's not many Yarra councils that have an opinion on this that actually provide opportunities and tools to actually manage it. And not everything goes to court. It just gives police. And the thing with police, and I'll chuck this out to, and I'm hoping I'm reaching out to more of the community-minded people that might be listening, is that, what's I going to say? It's about, sorry about pause, but it's a challenging environment and we don't shy away from that. But the thing, Yarra is really, really unique. We've got a really proactive council that is having a crack at a few things, aren't they?
Yeah.
And if they miss the mark a little bit, they've been voted on and they're having a crack at a lot of things that I've been really, really impressed with. So I've been around the police force now for 30 years, and the engagement that the council are doing with community is ridiculous compared to other councils. And if they push a bit too hard and get it a bit too wrong and these conversations occur, then, okay, well, we'll just recess and move on. But, God, how awesome to have a proactive council that's having a crack. And not only that, put themselves out there to be ridiculed or let's say creative feedback or constructive feedback. But I'll tell you what, if a lot of areas do it the same way that we're doing it down here, and do you know what? In Yarra, we inherit a lot of people's problems. We're attractive. It's an attractive council. And so like I said before about my mob coming down here, there's something about whether it be Fitzroy Legal Council or the health service that's down there in Fitzroy as well, is why we're attracting these people off country. Then unbeknowingly, we're actually attracting also the cultural problems of mob being off country. Yeah, and that's a really, really big challenge. And and personally, with my traditional hat on still, is that the people that can address that are not at the table. But and I do drift a little bit now because the conversation went pretty wide, didn't it? It went down to schoolies in Rye and it went to Aboriginal over here, yet the conversation is about the bylaw.
Yeah.
You know, so I'll give you that for free. Whether or not I want to be ridiculed because of that, as I'm a police person talking like this, I'll deal with that because I need to now deal with how do I become an influential senior Aboriginal policeman in Victoria Police and what that does for my people.
Well, Jim, if I ever get to vote for anything, I'm voting for you, my friend. Okay, so I appreciate your honesty and your frankness. I really do, and I think we all do here. And congratulations, by the way, too. Well done, my friend. Now, there was a question asked before by Sally around evaluation, which Lucas answered in the chat room. But Rob, can I throw to you? Tell me about the importance of evaluation. Again, can you just outline some more? Whatever happens, we're going to have to evaluate the outcome, whatever version we end up with. Talk about evaluation for us. You there, Rob?
Well, yeah, sure. No, I mean, I think if you're implementing a program, for example, then really you do need to have a theory of change. So to work out, well, what are our inputs? What do we expect to happen? What are we actually trying to achieve here? So, and the clearer that is to everybody, the more chance you have of it being implemented in an effective way. And you really need a good theory of change to be able to build a good evaluation outline. And the more, in a sense, you're asking the questions as you're designing a program to say, my goodness, now, what do we really expect to happen here? What would success look like? And how in the hell would we know about it? What would we be measuring? So that you're really thinking about that as you're designing it, not after the fact. And it's so important to be thinking that way, rather than do it after the fact. And again, I've watched it in really big programs, but it's also really important. These community programs are actually really hard to evaluate. So you really got to make sure that, well, we either have the design or we have the data to be able to tell us what's going, what will change, what we expect to change, because you don't have a control to judge against. But you can learn a lot more if the thinking is done now rather than halfway through or at the end.
Thanks, Rob. I just point out that Lucas also talked about the limitations of the new law, and it's in the chat room. I won't read it all out, but thanks for that, Lucas, clarifying the parameters of the revised Local Law 8. There was another question here, and that was from Sophie. Ask Rob. Certainly, Sophie, I'm going to throw to you. Just doing two things at once. I'd like to ask the panel a question about move-on orders, if possible. So, Sophie, what's your question about move-on orders?
Thanks, Peter. It's about some move-on orders. It sounds like under the Summary Offences Act, and they have criminal implications. So my question is kind of two-pronged. Firstly, I should say I'm completely on board with the health-based approach. I think everybody seems to be coming from a really good angle tonight, and it's nice to see people on the same page with this. It just, means we've got a really good starting point. So the move-on orders, they have these kind of criminal implications. My wondering is if this local law, in its much more limited form than what it currently is, like in the form proposed, does that allow a kind of middle ground approach for people to take? And by people, I mean both community members, people on the street, traders who can come out and say, hey, sorry, did you know you're not actually allowed to drink on, for example, this area outside of a licensed venue? Do you mind tipping out your drink, or do you mind moving along? and also police, that if police come across this person, they have a law to rely on that has no criminal implications. Is that in some circumstances a useful middle ground? I asked Megan about this earlier today, so apologies for the double question there. But I'm just keen to know if this can be seen as a stopgap in some places so that we don't have to rely on things like move-on orders, or do you still think it's just better not to have it?
Okay, that's a general question to the panel. So whoever would like to jump in first and answer that, be my guest.
Look, I will speak first, but only until the lawyers jump in before me or after me, in so much as the move-on powers are common law, not under Summary Offences Act. Okay, so there's no offence for not moving on. The offence for police then transitions into, I've given you a lawful direction and you haven't moved on.
Okay.
So that's the subtlety of it, if that makes sense.
Yeah.
So I'm happy for the lawyers to jump in now because I'm only a policeman, remember. But yeah, and the reality is too is let's go back to leverage off the public drunkenness decriminalisation about it being a health thing. If we thought that someone was drunk enough that we needed to intervene, it wouldn't be a move on. It'd be a health issue. It's like, well, do you have somewhere to go? Can someone pick you up? And then ultimately, if someone can't look after themselves, then the last resort is, well, we'll take you into our custody because we can't trust that you look after yourself. And that's the simplicity of it. So does someone else want to jump in?
Thanks for that, Jim. Go, George.
I think I was kind of with Jim right until the very end, which I think is that at that point of, if someone, is not able to, that they don't have someone that can sort of help them at that moment, the place that they should not be taken to is a police holding cell. Like they should be taken to, and I guess this is part of thinking through what the health-based response is, taken to a place to sober up, but not a police cell. Like it should be something that provides the relevant supports for somebody to sober up. So it was with Jim right until those final couple of words.
Oh, no, you're exactly right. But at the moment, there is no sobering place. So we are, unfortunately, the default. And the minute that gets taken away from us, make no mistake, we are all for it. Yeah.
So anyone else want to have a go? Megan, Rob, anyone? No?
I'm hesitating because I think thanks for that question, Sophie. I think my ultimate response is that the experiences of a lot of Fitzroy Legal Service clients are that interactions with police can often escalate. And I'm just trying to imagine a situation where, like, why are we asking someone to tip out their drink? And if they're not doing anything wrong, then why the intervention? I think I'm just getting I'm getting a bit tripped up on coming back to the purpose. And actually, I was thinking this when Rob mentioned before, if you have a theory of change, I think that's one of the challenges with the conversation that we're having tonight and that we've been having for a while, which is that this seems like an instrument that is directed towards a couple of different purposes. And so if the purpose is to be able to respond to people who are drunk, then, we're talking about health-based responses. If the purpose is about event management, then I guess that's a different thing. And if the purpose is about amenity, whatever that means, then, that's another thing. And so I think we just need some more tailored solutions. And Sophie, I realise I didn't really answer your question, and I'm sorry.
Oh, good. It's a complicated one.
Yeah, I think that's been one of the challenges throughout this, and I'm sorry, Peter, I know I just cut you off, but I think that there's, a lot of anecdotal evidence about, including some that I have advanced tonight, about, how it does work, how it can work, and a huge variety of situations in which it could work. Yeah, and so I think that's one of the challenges in talking about whether it will work.
So I think, Lucas, you want to jump in and make a comment?
Just a quick one, for sake of clarity, Peter. I think it's also really important to say that what officers have put in front of council absolutely is not about asking vulnerable people to tip out alcohol. It is not about targeting them at all. We're talking about situations where we might have 25 or 30,000 people on Swan Street at once, all of whom are engaging in preemptive drinking. Part of this is about the practicalities. It is not practical to move on that number of people, and it is also about a proactive conversation with the community about what behaviours are acceptable in those precincts at very specific times. Remembering that, of course, we're not saying that for every day of the year. We're simply saying that that's around some of those major events. And that is absolutely the intent of it. So we are not talking about trying to make this about vulnerable people at all. In fact, we've tried very hard to make sure that message is extremely clear.
And I think, in fairness, Lucas, we would all acknowledge that, and again want to acknowledge that the council officers and led by yourself and others, there is no implied criticism of council. We think this has been a really, from my point of view, a very productive process and conversation, and I'm just wrapped that we're really talking about, there's so much more common ground than there is uncommon ground in this. But thank you for your clarification, Lucas. I'm just getting conscious now of the time. Are there any other questions that are urgently on people's mind? Because you're probably all keen to see how West Coast and Melbourne are getting on together at the Wacker or wherever. No, they don't play at the Wacker. That shows you how old I am. So I just invite any last comments from any of the panellists. Anything you'd like to say to us before we call it a day? Any comments at all? Jim, George, Megan?
Well, whilst others are thinking, I'd like to think that the different panellists and community members that are listening now, that I'm sort of hoping that the transparency and our willingness to listen and understand is, I don't think anyone has come up with, has been defensive. Now, I think everyone's been quite as transparent as we could be, and it's got to be reflective of us moving forward really collectively. And I'd like to think that whether we're right, wrong, or of different opinions, that there must be some comfort amongst the membership that are listening now, that voices are being heard, they're being considered, and there are no conclusions at the moment. But surely people must feel comfortable that the right people at the table, they're listening, they're talking, decisions will be made, and they'll be considered decisions. I'd like to think that.
Thanks, Jim. And Megan, George, Rob, any closing comments?
I think that is quite the note to end on, so I wouldn't want to add anything.
Okay. Well, look, I'd just like to thank and acknowledge the speakers. So I don't know how you do this on Zoom. Do we all wave our hands saying thank you or whatever? Do I look like an absolute idiot by doing that? I probably do. But I'd just like to acknowledge the contribution that everybody's made. I'd like to again acknowledge that this is a complex issue and that we really look forward to moving and working together with people of good intention and good spirit to get the best possible reduction of harm within our community. And Jim said it well before, that Yarra is a fantastic place and served by so many fantastic people, councillors, council staff, organisations, residents. It really is a joy to be part of this community. And in conclusion, I'd like to say that as I get older, I think answers are less important than asking the right questions. And I think we need to be open to each other's questions, and we need to be open to the possibility of being wrong. And we look forward to this being concluded in a really positive way. But finally, I want to give a plug. Join up to our regular newsletter or a link on the Yarra Drug and Health Forum via our website, and we have the pleasure of hosting Fiona Patton speaking on Monday afternoon at 1 o'clock on the process and the recommendations from the State Parliamentary Inquiry into Cannabis. And she's the only person speaking, and she's going to speak to it, and then it will be Q&A. So 1 o'clock, Yarra Drug and Health Forum for a couple of hours. So on behalf of everyone here tonight, I wish to thank you very much for attending, and thanks for your respect that you've all shown to each other. And have a great night. Cheers. Bye-bye.